Now let's get into the crux of the smart healthcare. Why do we need a smart healthcare in the first place? Because there is an evolution taking place from 1900, from the traditional medicine to the proliferation, the baby boom after the World War II, where we have seen the introductions of the diagnostic equipment like X-rays, where we have seen the introductions of the vaccines, the vaccinations takes place, where you've seen the accumulation of scientific knowledge, and then we entered into a commoditization era, where the healthcare has become a national business, where the private healthcares or the big healthcare facilities have started catering to the large volume of patients. Because in this phase, like the other industries, airlines, like the other big industries, the healthcare became a price takers, and they started to cater the large volume of patients to maintain their margins. But now we are into the personalization of care era, where what is the difference between these two? Here, the new technologies are evolving, the new technologies are being introduced, where we are introducing telemedicine, where we are introducing the remote care for the patients, where we are recognizing patients as an empowered consumer, not as a passive consumer. Now, with the changing healthcare environment, what are the changes which are happening in disease, patients, services, and in operations? So now in services, the more efforts are being made to treat chronic diseases and non-communicable diseases. Earlier, it was episodic and acute diseases. Regarding the customers, there is a paradigm shift in the customer place. First of all, they are all reactive and passive, but today they are proactive and empowered. Regarding the operations, we are moving from fragmented era to a well-coordinated era, where the services are coordinated with the continuum of care. And the technology space, we are moving from an analog paper-based system to a digital space with the tab and the mobile. If you look at the big picture for the future of healthcare, so what does it say? What does the transformation means? The transformation means the accessible healthcare. The healthcare should be accessible to entire mankind, and it is only possible with the technology in place, because it is impossible to reach all the professionals, all the skilled workers, to each and every patient and cater their needs. And if you look at the personalized care, how it evolves with a skilled staff with mobility, who have a cycle of events to cater. That is from monitoring, prediction and early detection, diagnosis and preventive interventions. And then he will collaborate with insurance, pharmaceuticals, government and the hospitals. And all this will culminate down to affordable operations, because my earlier speakers have put a lot of stress on the affordable operations. Yes, it has to be affordable, where the patient needs to be identified, there needs to be analyzed with the streamlining of medical processes and provide a cost-effective healthcare infrastructure. So key challenges. Today we are facing what are the key challenges. If you look at India, so this is very pertinent. One is the accessibility, which I've already discussed. It is hard to provide healthcare in remote regions. Today there are undeserved regions where the healthcare is much needed, but are you able to provide? So that's one of the key challenges. The care service. Difficult to provide a personalized care. India is a huge country. We have a huge population. The patients are yearning. They need a personalized care. Are you able to provide them? So these are the real challenges. And in terms of operations, today, very sorry to say, but it is ranked 1 in the efficiency, because it is a fragmented, highly fragmented operation system. The ecosystem is not well coordinated. So let us work towards improvement. How we can improve? By taking the strategic initiatives, making the healthcare accessible, increasing the number of healthcare touchpoints. I have earlier said we can only improve the healthcare touchpoints by increasing the use of technologies. And while achieving this, we have to remember the healthcare equipments alone cannot do. We have to have a seamless integration of softwares, seamless integration of devices, the consumer electronics, and healthcare devices. And then comes the improved quality of care. Provide personalized care with skilled workers, collaborate to improve care outcomes, because the collaboration is an utmost important. Again, the building affordable operations is a key. So the entire process has to be built upon an affordable solution. So how to increase the number of healthcare touchpoints? Provide services to patients in remote regions, ensure smooth and secure exchange of patient information between patient and physicians. So these all need devices. So I will come in details in the case of devices in the following slides. We will see how Samsung is working towards it. And provide home health care such as self-diagnostics. My earlier speaker has told that the healthcare is coming out of the realms of hospital care and it is moving towards home. Expand the range of services, offer a wide range of healthcare services, increase accessibility by increasing the service range, consolidate between the institutions to improve the service range. Because in India, it is also a very pertinent question because there are a lot of good government institutions, good private institutions. There are tier 2, tier 3 cities. And it will be useful when we can exchange the information between these medical colleges, big institutions in private like Apollo, Fortis, Max, and we can give a better service to the entire mankind, to those undeserved regions. And this building the affordable operations. In case of India, one of my earlier speakers spoke about volume because the margin is very less. So the entire structure has to be built around an affordable solution. And this can be realized when you automate the medical processes and eliminate duplication and complexities in the operating system. And effectiveness is also will be the key to manage the cost. That is how locate critical and high value assets in real time, ensure timely and efficient maintenance. This is the key to cut down the cost. Reduce stock levels through greater accuracy and visibility of inventory, and provide a cost-effective, efficient infrastructure. The smart technology in the healthcare. So here we see it is an seamless integrations of consumer electronics, healthcare devices to improve quality care, make healthcare accessible, and build an affordable operation. So what we have done, because what we have spoken about the back-end, the front-end solutions, we need a device. So Samsung has come up with a biometric device called Iris Tab. So it will recognize the iris muscles of an individual and will dig out the entire information from the other linked server. And we are also, by introducing it, we want to become a part of Digital India. So how it happens? It takes the individual records at PHC level, birth certificate and vaccine, info electronically stored, access of healthcare records and certificates to other-based DigiLocker, interoperability in healthcare records, which is consent-driven because privacy is one of the concerns, and EMRs to be accessed by multiple healthcare providers securely. It has been launched in India, and we are in discussion with the government of India to make it viable and a practical solution. So Samsung healthcare portfolio is present. It is a reality to enhance the patient experience, both in terms of consumer electronics, mobiles, and medical devices. So this is a glimpse of the medical devices which we have today, starting from digital X-ray, color Dopplers, in vitro diagnostics, and mobile CT. So this is our vision. Samsung wants to inspire the world and create the future through our innovative technologies, product and design that enrich people's lives and contribute social prosperity. So today what you have seen, the unification of informations and the reusability can add newer capabilities without interrupting the day-to-day activities. Thank you.